Welcome to the Cal Fire Show. I'm Dr. Kelly Barron, and today I am very excited to have back a guest that was on a few months ago, Brooke Braylove, and she talked to us last time about sexual wellness, but today we're going to talk about a different topic. But first, let me introduce her credentials to you and tell you a little about her. Brooke is a licensed clinical social worker, a psychotherapist, an ASEC certified sex therapist, Master Accelerated Resolution Therapy, ART, practitioner, and certified Daring Way facilitator. And I don't think you could fit much more credentials in there. Brooke specializes in treating adults, couples, and groups with anxiety, trauma, and sexual relationship challenges. Brooke helps women of all ages let go of perfectionism, which is so tough to do, and move toward greater authenticity, joy, pleasure, and connection. She has maintained a private practice in Maryland for 21 years, and today, very excited about this, she's going to talk about accelerated resolution therapy. So Brooke, welcome today. I always enjoy talking to you, so I was excited we're going to do a different topic today, and one that, I just started learning about by following you. So if you could let us know if there's anything else that I missed, and jump right in and tell us, what is ART?
Sure. Well, first of all, Kelly, thank you so much for having me back. I was thrilled that you wanted to talk again because we had a great, easy conversation last time. And so I anticipate it will be the same today, but a very different topic, although it can be a little bit related. So what is accelerated resolution therapy, and why do I go on as many podcasts as is humanly possible just to talk about it? And why, when I talk about it, do I often end up with goosebumps or tears?
Okay.
Which is literally true. I can't guarantee it will not happen here today.
Oh, no, bring it on.
Yeah, it does. It really does. So you can call it ART or ART. I will probably go back and forth between, sort of what I call it. But I do think that when you call it art therapy, a lot of people think you're talking about crayons and markers. And of course, That is not what this is at all. But accelerated resolution therapy is an evidence-based treatment modality that uses rapid eye movement and voluntary image replacement to change the way the brain stores distressing images and the corresponding negative sensations that show up in the body. Ooh. So that we can basically help people keep the knowledge and lose the pain. And so what that means is you will work on a number, people come in for all different reasons. It certainly began as a trauma therapy. And so what will happen is somebody's going to come in and they will leave with the same knowledge of the facts of what happened to them, but the pain associated with those facts will be gone. So often if someone has, let's say, some combat trauma, and it's showing up like when a car backfires, they jump, or, God forbid, fireworks on 4th of July. Sometimes people literally have to bury themselves in their bed under covers with headphones because they get so dysregulated when they hear that type of sudden noise. And it basically stops those types of situations from causing that response, that fight, flight, or, freeze response in the body. So that they might be like, oh yeah, I hear those fireworks, but I'm not triggered, I'm not agitated, I'm not jumping out of my skin. And the power of ART is that it can do this with almost no talking.
Ooh,
and in 1 to 5 sessions.
That was going to be my question. And no talking. Okay.
Yeah. So for a lot of people, and I often think about men here, right? Stereotypically, men don't like to talk about their feelings, so a lot of men don't go into, long-term talk therapy or really kind of any therapy in many ways. But when you say to somebody, hey, you don't have to tell me any details of what happened to you or what we're working on, and I can still clear this trauma for you and make it so that you have a very neutral feeling. Often I think about it like just almost no feeling at all. You can
Right.
report, when I was in Iraq on this day, this happened, but you're not going to have any emotional attachment to it or distress around it. It doesn't mean that you're sharing something positive, but you will not have any of the same negative body sensations that you would have before you did ART.
So what if someone has let's stay in the area of trauma. Let's say they've experienced a trauma, they know it, they've compartmentalized it, so they're not consciously aware of what it's doing to you, what it's doing to them, or what they think that it's doing is just normal. Would it still work with that if they don't really know what it is that they're experiencing?
100%. It even works when you don't remember your trauma fully, or maybe even at all, because sometimes when you just simply pair eye movements, this rapid bilateral eye movement, with asking the brain to show you what's there, sometimes it will actually recall things that are facts of what happened. But sometimes the person hasn't even thought about that instance or that moment since the day it happened. So it works whether you know kind of what's happening or not. And frankly, often the way we get people in to try ART is that they feel stuck. They
Right.
can't move on from, a relationship. The reason I am trained in art is that I was a patient. I had a very traumatic breakup in 2017 that for the life of me, talk therapy wasn't touching. I tried, yoga therapy and different somatic type, experiences. And I could not stop crying about this relationship because it was very traumatic. And I did 2 sessions of art, and I've been very neutral about the whole thing since then. And, that's 8 years ago now. So I've just been very neutral. I can talk about him, I can see pictures of him, and I have literally no response in my body, whereas that would have sent me into a complete panic, crying
Wow.
fits, etc. So I also think what's so important is, I've done art. I know I continue to do art when there's something I need to work on. And so I know for a fact that it works, and I know that it's life-changing, because I was not going to be able to move on from that anytime soon, from that breakup.
Wow.
And so it really is the most powerful thing I have ever experienced in terms of therapies, and I've tried lots of different therapies over my life, and also the most profoundly life-changing to implement. And so, I will sometimes introduce ART to a long-term patient who I've been doing talk therapy with. And I might say, like, hey, we've talked about, this sexual assault in college, and we've worked on it, and it's definitely improved. You've let go of some of the shame and guilt and self-blame and all of that. But you just told me that when you go to bed at night and your husband touches you on the shoulder when you weren't expecting it, you jump out of your skin, right? That's an automatic nervous system response. You can't fight that. You
Right.
can't rationalize that. You can't tell your body to stop doing that. The body does what the body does because it holds on to memory more than, your intellectual brain. And so, for instance, with that patient, we did 2 sessions on the sexual assault, and she felt completely comfortable with her husband. She wasn't flinching. She actually welcomed his touch. She enjoyed the touch. And this was just, a bid for connection. We're not even talking
Right.
about sex at all. Just, a nice bid for connection when you're lying in bed with your partner. And all we had to do was process this sexual assault while doing rapid eye movement, this bilateral brain stimulation, which calms the brain and calms the body. And what we do is we take this negative, terrible scene. We have the patient recall it in their mind. They don't have to say one word about it. So again, you're not re-traumatizing them, because you're not saying, I want you to talk about in detail what happened with every single specific horrible detail. And they're doing it in their mind. They're like watching a movie, basically. And as they watch that movie, we can imagine that negative sensations are going to show up in their body. So with this, patient, when she was imagining the sexual assault from college, she had, her throat closed up, she had chest pain, and she had trouble breathing. So the distress usually only lasts a couple minutes because the eye movements themselves are calming the body. So as soon as those sensations come up, again, we're doing eye movements. And so very, sort of gradually, those negative sensations start to dissipate. After they've seen this, instance in their mind, they see it again to kind of basically to take the sting out of it. And so when you see it for a second time through, it usually feels a little different. Sometimes people will say it feels like more in the distance, or parts are missing now when they try to recall it. And again, any negative sensations, you're going to calm those just by focusing on the sensation in your body. And then we give them an opportunity to rewrite the script, meaning they can change it any way they want. Maybe they didn't go to the party that night where they were sexually assaulted. Maybe when they saw that this guy was creepy, they said to their friends, let's get out of here, this guy's a creep. Maybe the second the sexual assault began, police barged in and saved her. Maybe she, kicked the crap out of this guy and saved herself. And the brain knows how to heal, so the brain will come up with the best story it needs to come up with. And so I don't tell them what to do. I don't let them pre-plan it at all. I don't want them thinking about it. In the moment, I want the eye movements and their brains to guide them into a solution, an outcome, the way they wished it had happened. And then we store that in the brain. Because when they're imagining that positive outcome, guess what happens to their body? Positive sensations. And then we just want to spread those all around. And that's kind of the basic gist of ART. There are lots of other things. It's a very clear protocol so that we have resolution at the end of every session. Almost never has someone walked out of my office feeling as badly or worse than they did when they walked in, because we don't stop the protocol until they get to the resolution.
That's what I was going to ask you. Is there a particular length per session? Or
So people our ART practitioners are different. I prefer to use a 90-minute session so that we are never rushing, that I'm never asking the person to speed something up. I can often get it done in 60 minutes, especially if I've seen this person multiple times and I learn how their brain processes. But sometimes it also depends on how long that incident is, meaning how long they need to process it. And so that can vary. Some people's, incident was 2 seconds, and so we clearly wouldn't need a super long time for them to see that over like a movie in their head. If it was something very sudden, that's not usually the case. I mean, there's usually before something happened, after something happened. And again, it's their experience, so they can start it where they want and end it where they want. It's not my experience. And so their brain tells them what's important that I need to process today. But it literally is science-based, but what happens in that room or on the screen, because ART is equally effective virtually as in person, which
Okay.
still surprises me, but I have
Right.
a ton of evidence that says that. Literally 100% the same efficacy. We see that they can get through this super fast, and there's this healing that occurs that is magic. It's magic. So again, science-based, evidence-based, but what people's brains do to heal is magic. And ART uses a lot of metaphor. So we work in metaphors because the brain loves metaphor. And so often, like I have a patient who, for whatever reason, when she's trying to calm herself, whales come and escort her through the sea, through the
Oh, I
ocean.
love that.
And that happens almost every time because she's learned that that's the way her nervous system calms down. But you can work a lot within metaphor to work on a problem as well.
What, obviously trauma,
Yeah.
and there's, a million different things that fall under trauma. What else do you see? What are some unusual things that people come to you for ART?
Yeah, well, this is what, again, when I first started, I had no idea that what I would get to is the belief that anything you go to therapy for, regular talk therapy, you can do with ART. And so that means things like, I want to get along better with my sister-in-law at Thanksgiving. You come in, you imagine all the times you didn't get along with her, all these times that y'all got in fights and it ruined Thanksgiving and it blew it all up. And again, you just change it the way you want it to be. And guess what? It changes relationships. I had a woman who really had trouble with like her daughter-in-law. It just didn't go well. And the next time we worked on it for one session, the next time the whole family got together, everyone noticed that my patient handled things differently. Everyone. The daughter-in-law's husband noticed,
Oh,
her husband noticed. Everybody could tell there was a shift. And that was after 90 minutes, one 90-minute
that's
session.
pretty powerful.
Yeah. But what else does it kind of work on? So any feelings of stuckness, any inability to move on from something works really well. I have actually treated low libido with ART.
Okay.
Yeah, which, and the way I think, is the really exciting kind of places are things like low libido, where someone comes in and, they think about all the times they didn't want to and it was bad or it hurt, menopausal women, again, lots of, pain with sex, avoidance of sex.
Right.
And they imagine all of that, and then they imagine the way they really want it to be. And I've had people report that they go home and, whether it's that night or the next night, they have the best sex they've had in 6 to 10 years.
Wow, that's powerful. That's
Yeah.
very powerful.
I've also had people, we have a very specific script we use. I don't want to give too much away, but basically it's a script we use if you're like annoyed with your spouse. And maybe you're not liking your spouse that much, you find them irritating, which is all normal in marriage, right?
Yeah, absolutely.
So
Absolutely.
normal, but maybe it's really getting in the way of them feeling love and connection. We do this script, and I did a 1 minute, 60-minute sessions with a patient, and she came in the next week and she's like, all that annoyance is completely gone. He's great. I can see all his positive qualities. Every single one of those things gone or diminished so much that it doesn't feel important.
The amount of marriages you could save on just communication issues alone, but like with that, for whatever reason they're not happy with their spouse, with what they're doing or how they're acting, and that's just manifested because of something else in it, and they stop looking, like you said, at the positive side, and they're choosing to only like look and amplify the negative side.
Yeah, absolutely. I mean, when we start feeling negatively about someone, we then go and search out all the information that is going to confirm how annoying they are. And guess what? You'll find it. It's always
Oh
there.
yeah.
But with ART, we flip the script. We desensitize you to how annoying, that habit is, or the way he, drives or whatever. And then we give you some perspective on how much does this really matter? And then you leave with that, and you are literally less annoyed. I've also done that script myself and noticed a massive reduction in my annoyance for my partner at the time. Things that used to just get under my skin, I'd be like, this isn't such a big deal. And then I could focus on
Right.
what I loved about him. So I know it works personally and professionally. What are some other things? I mean, the list is
I
endless.
think that
It
that's
works,
great.
yeah. So it also works on depression, chronic depression, seasonal depression. It works on anxiety. It works on OCD. We can sometimes trace back OCD to when it started, the first time the person started doing an OCD behavior. And if we clear that up, they don't need to continue doing their OCD behaviors. I've had a lot of success with that. It works on insomnia. I've gotten people sleeping better through the night, which is a
Oh,
massive
yeah.
problem in this country. It works on sometimes learning differences, learning disabilities. It can work on ADHD. It works
Wow.
incredibly well on phobias. Phobias rarely take more than one session. So if someone's been in a car accident and now they're phobic of of driving, 1 or 2 sessions, they're back on the road, feeling confident and happy. That's worked multiple times. Fear of driving over bridges, again, we get people through that. Fear of flying. There are so many people who, pop an Ativan before they get on every airplane ride and they're still white knuckling it.
Right.
That's an easy fix, that kind of thing. So again, spider phobia, I mean, you name it. But it improves relationships because a lot of trauma is not what people think of, right? You say, do you have childhood trauma? And they're like, no, I never, witnessed something horrible or went through a flood or, nobody abused me or whatever. But parents are imperfect, and there's often a lot of attachment trauma or attachment kind of misses, right? And so maybe, although you didn't have, this big, huge trauma, maybe every time you got a 95 on a test, your father said, where's the other 5 points? What happened? And, was chastising you for not being perfect. Well, that sits and stays in your body. And it shows up when you are a perfectionist and you can't tolerate your own imperfection, or you can't tolerate imperfections in other people, like your spouse or your kids. So we work and repair that attachment trauma, and those things change. So I've helped people who have anger issues and hate the way they're talking to their kids. We do a few sessions. I've changed children's lives by helping their parents do it differently. And people will say, I mean, I have a guy I've been working with for about a year. He loves art so much. All he wants to do is art, and he wants to tackle every single little or big issue in his life. And his children are actually saying, Dad, we don't even know what to do with you because you don't yell at us anymore. You're present. You want to hang out with us. We literally don't know what to do. It's so different. And that's just a fact.
Do you ever have anyone nervous or scared? Like they know they know they're holding on to this. They know they need to clear this out of them, but they're either scared that their memory is going to wipe out, and or are they scared that without, even though they want to get it to go away, if they want it out of their lives, that if it does leave their life, will they lose, say, like their identity? Do you have people that get scared?
100%. I have not found that people are scared they're going to forget, because we really do reassure that we're working with different parts of the brain. So I think that most people, that anxiety goes down. And again, no one has ever said they couldn't recall something. Now, they might not be able to recall that terrible look on their perpetrator's face, but we want that gone.
Right.
That's the intrusive images we don't want them to see. But facts, no. But yes, you bring up a really good point. When people are very tied to something like depression or a chronic illness, and when people may get secondary gains from staying attached to that, like maybe, if they have a chronic illness, if they healed that, what would happen to the community they've built? What would happen to the way they've been able to spend more time with a parent, because the parent has needed to care for them? Mm-hmm. So when you have secondary gains, it can be a little bit trickier. So I think the question you're asking is very important. So we often will have to try to talk about, are you willing to give up this secondary gain? But also, it can also just be fear. I have never known a day without my depression. So I am scared to believe that there's something else. And it's so foreign to me that I'm not sure I'm willing or able to let this identity go. And again, we have scripts that are around fear of change. So we will often work on that first before we actually tackle the depression itself or the chronic illness. We'll work with their fears.
I think it's how you just said we have a script for fear of change, and immediately I'm like, there's so many ways this can be applied. If you think about all the different things in your life and things that might be holding you back or causing you to act in a way that's not beneficial for you, or you can be better. You just said fear of change. I can only imagine just the different things, small different things in your life that this could help, and in such a non-intrusive way.
Exactly.
It's a very safe, non-intrusive way. Like you said, the power is all within the individual.
Right. And they're doing it. Their brain's doing it. I'm just a guide. And their brain is healing itself. I'm not, I'll make a couple suggestions here and there, but the brain wants to feel better, They want us to do better. And so they're like, they just need the right opportunity. And the opportunity is these eye movements. The magic is in the bilateral stimulation. ART really focuses on eye movements. But if for some reason someone can't do the eye movements or doesn't like them or has trouble tracking, they can also use tappers, or they can themselves do like butterfly tapping. So there are ways around it which are equally effective, but we don't start there. We really want people to try the eye movements as much as possible.
And
go ahead.
Can you kind of explain that to everyone that's listening? Like why the eye movement? I get it. It's wired to your brain, but why the eye movement?
Right. So eye movements, or bilateral stimulation in general, allows the left side of the brain and the right side of the brain to activate at the same time, which most things, it's either one or the other.
Right.
And so what you're doing is you're taking your creative side, the side that likes metaphors and imagery, you're bringing it online, but what you're also bringing online is the problem-solving part. And so those two parts are working together for the entire session. And so people will actually, we also use it for something around, if you have a difficult question, like, should I leave my job? I'll say, even if I'm in a talk therapy session and they'll be like, I don't know what to do. I feel totally stuck. I don't know whether I should leave my job. And I'll say, well, do you want to ask your brain? Let's do some eye movements. And we'll just do, a few sets of eye movements. And I'm not kidding. These people come to the decision. They come to it fast, they come to it furious, and they come to it for real.
Wow.
And then they leave going, well, that's clear. Now, what they do with that information may not be the same, right? Whether they act on that is their choice, whatever. But if they're being honest, they come to it really quick. And they can also find, a scene from the past. If you ask the brain to show you, like, when's the first time you felt this level of anxiety in your body? They will search their brain, they'll allow their brain to show you, and it'll be something like, it was the day that my mom didn't pick me up from school when I was 7, and I was so scared that she had died or she had left me. That one incident, if you clear it through ART, through the magic of this protocol, you can help somebody manage 30 years of anxiety and get rid of it. Because their brain, you couldn't say, "What do you think you have this anxiety, sir?" And they could come up with, "Well, there was this one time when I was 7."
Right.
They're not going to come up with that, but their brain will take you back to that moment. And what I always tell people is, whatever moment you're seeing, that's it. That's the one. You don't have to say, "I wonder if it was this time. Maybe it wasn't. Maybe there was another time." No, your brain just showed you the key. So let's go unlock it, and then we clear up current problems around anxiety.
I'm fascinated. I'm literally fascinated. I'm just thinking, the power of the brain. I mean,
Yes.
we don't talk about it enough. We certainly don't give our brains enough credibility for all the things that it can do. I mean, and I know all the things that the brain, the body can do that we're just not aware of.
Right.
But to be able to allow your brain to actually tap into the power that's sitting in there and bring it forward to you. I mean, you talk about, I know, like microdosing or magic mushrooms, if you will. Like, a lot of people are turning to those to try to answer that question or find this or find that. And that's to everybody, each and everybody's opinion of whether they want to go down that road or not. But if you say, well, you can try this, you don't have to take any substances in your body, you can literally just try to tap into your brain yourself. I mean, that would be my first go-to.
Yeah, and by the way, the thing about ART that I love so much is you don't have to change a thing in your life. You don't have to stop taking medication. You don't have to wean off of everything. You don't have to stop your individual talk therapy if you love that. I mean, that's why I think it's so easy to promote ART, because to let other therapists know when they're stuck with someone, when their work is going well, but like there's this one thing this person can't get over, or no matter how much they talk about the fact that they're afraid of spiders and they've tried, all these different methods, cognitive behavioral and ERP and all this stuff, and it's not working, then I say, well, just send them to me. I'll give them right back to you. I don't want to keep them. I want them to get them in and out. That is the goal. It's a terrible business model, by the way. Literally,
yeah, seriously, terrible.
The worst, right? Because we can get people in and out in like 1 or 2 sessions.
Yeah.
Sometimes people like it so much, though, that they do choose to stay. Because when you see how well it works for one thing, you're like, well, now I want to address the fact that I binge eat at night, or the fact that I bite my nails, or the fact that I had a birth trauma and I'm pregnant with my second and I want to have a good birth. And that's worked beautifully. I mean, literally healing people from these terrible births that have haunted them forever, that they sit around feeling guilty about and then worry about their next, pregnancy and delivery. And I talk to them and they have these great deliveries because we've already practiced it. Your body's already seen it in your brain, and we paired it with positive sensations. And all we did was have you leave with that versus leave with the trauma of what actually occurred.
I'm thinking of so many things now.
No, it's endless. It is literally endless.
I'm thinking of something like, and I'm thinking of using me too as like a guinea pig. I'm like, okay, let's try this, and let me try this and see how it works. And then I could say, okay, refer this one over, and
And you know what else it works with? This is where also I think it's so important. We can tap into the corporate world here. It works for performance. So if someone is, not hitting their numbers, they can come and do ART and figure out why. What's that about? What's happening?
Right.
And usually there's something that happened in childhood that made them, not feeling confident, or they got a bad SAT score. I mean, literally, someone's PSAT score showed up in an ART session yesterday. They're feeling overly responsible, like they're going to fail at work, or they're feeling overly responsible for their team. And all we did was trace back the negative sensation that came up in their body. And it was when they got a bad grade on the PSAT and didn't think they could go to the college they wanted to go to. We cleared that up, and they're like, oh, I can totally do this job. I'm good. And I don't have to feel overly responsible because I can just do this. It works amazingly well on fear of public speaking. That's one of my favorite things. I've helped family members with multiple issues, fear of heights and public speaking and insomnia. And that's the best too, right? Because it's not ongoing therapy. I would never do therapy with my own friends or family.
Right.
But I can do a quick, 90-minute ART session and just clear them of that, and they keep it moving.
I love it. I do think I'd be like, hey, Brooke, it's me again. I know I was here yesterday, but today's problem is...
Yeah, those are my favorite people who want to just keep attacking different problems.
Right.
Because their entire lives are different. Their family relationships, their marriage, their work relationships, their feelings about themselves. It works so well on shame, letting go of shame, letting go of guilt. Works beautifully. I mean, I worked with a woman today on regret. Just the feelings of regret she had that she could trace back to an incident that occurred when she was 6 or 7.
Wow.
She didn't know those were related. We don't know these things consciously, but we get, and again, you're right, psilocybin, ketamine, all of these are vehicles into the unconscious. And all we're doing is creating the environment for the unconscious to heal us. That's literally what we're doing. And it's amazing.
It truly is amazing. I'm fascinated again by it. So curious about it. So I'll be calling you. And but can you work online? Can you work in every state with ART?
Yeah, so I actually have 2 associates because ART is so fabulous. I want to spread it everywhere as quickly as possible because I'm on a soapbox. I will stay on my soapbox. I like it, and I'll talk about it till kingdom come. So we have one provider who, due to her licensure, can see people virtually, literally in any state or all over the world. And so that's amazing. Yeah. And then I have another person who can see people in DC, Maryland, Virginia, and Pennsylvania. And I can do DC, Virginia, and Maryland. And, it's just the most exciting thing. I mean, I literally feel like I am witnessing the most sacred work of my life and of their lives, the people I'm working with. And especially around, working with women around like sexual trauma, people who cannot enjoy sex. I'm also, as you mentioned in the beginning, a sex therapist.
Yes.
So to be able to clear sexual trauma for someone and allow them to feel pleasure and safe in their bodies again is just fabulous, There are a couple things I do want to point out. So who isn't a good candidate for art? Right?
Oh, great point. Okay? Yes.
So there are 3 screening questions that we ask to figure out if someone is a good candidate. One is, can you move your eyes back and forth comfortably? So we don't want to see someone who had a concussion last week, right? Where it's contraindicated. Or someone who has a seizure disorder that when they ask their neurologist says no. Now, those people could use tappers in their hands for the bilateral movement. So they could still do ART, but we want to know, can you move your eyes back and forth? The second question is, can you hold on to a thought and an image? It does work better if you are someone who can, if I said to you, can you picture what you did, your morning routine? And if you say, no, I have no ability to do that, ART might be a little harder, not impossible, but a little harder. We do want someone to be able to have kind of a mental picture in their mind. And the third question, which seems like the obvious answer is yes, is a little more complicated. Are you motivated to change? And again, people think that's the dumbest question. Why do you think I'm calling you? Of course I'm motivated to change. That's where we get into that nuanced kind of secondary gain.
Right.
And that's going to be hard to literally, I mean, if someone says, no, I'm not motivated, like you can't bring a teenager kicking and screaming to art. They have to be willing to try. They do not have to believe in it. They do not have to think it will work. But they do have to actually be willing to experience it and, want to deal with the problem. So if someone, it works really well for addiction. If someone is not interested in quitting smoking, don't bother. Don't waste your money or your time coming to ART because you don't really want to give that up.
Right.
So unless the person's motivated to change, it won't work. But that's really it. Everyone else is a great candidate, and it can work. Look, does any modality work for 100% of the people 100% of the time? No.
No.
But, the research shows that its efficacy is over 70%. And the research shows that, especially with PTSD, the resolution of PTSD symptoms is in, I think, an average of 3.4 sessions.
That's nothing.
People spend 30 years in therapy
Yeah.
trying to get over their PTSD.
That's amazing.
And so, yes, is it an investment? It is. Is it worth it? 100%. Are you back doing what you want to do, living your life as quickly as possible? Absolutely. I only like to keep people if they are, that's like the therapy they want to do, right? They are
Right.
like, oh, screw talk therapy now. I want to just do this. Or I want to do a combination.
Right.
And a lot of people like combination. That works
I
really
would
well
think
for them.
combination would be really, really great. So you can, talk it out, but then you can also work on it internally with the brain. I think that's probably very powerful combination.
Yeah. And so it's limitless. I mean, I just think literally, there are no limitations on what it can help with. The other thing I want to address is what is EMDR and how is ART different than EMDR? So EMDR is a much better known eye movement, trauma therapy. Okay. And the reasons it's known is it's been around since the 70s. But there are some key differences. I like EMDR. I think EMDR is fabulous if it works for you. But there are a few differences that I want to point out if you're considering one or the other. So EMDR usually requires more sessions, sometimes 10 to 20, sometimes even more. It just depends. So it takes a little longer. EMDR does not use very specific, really specific protocol or a script. So it can meander a little bit, which sometimes means there's not a resolution at the end of every session. Whereas art, we're always getting to a resolution. It doesn't mean you wouldn't need another session, but you're not leaving the session wide open without having contained everything. And so that's one thing I really like about it. In EMDR, you can use lots of different types of bilateral stimulation. It's not again, it doesn't have a set number. With ART, there is a set number of eye movements we use, and so it's more uniform. With EMDR, you're often talking about thoughts and feelings. With ART, you're looking at images and sensations. So they focus on different things. And so, if you've tried EMDR and it didn't work for you, I would still try ART because also you're going to know within about 2 ART sessions whether it's useful for you. And so if someone says it's not working, I say, well, thank you so much. I'm sorry it didn't work. Best of luck to you. I never want to keep somebody if it's not working because we know, pretty quickly whether it's going to work. Because people will be, they'll come in and their anxiety level is at a 10 and they leave and it's at a 1 or a 0. So we know it worked.
Right.
And it isn't temporary. most of this change is forever. There are occasions where someone will say, "Oh, that thing we worked on last year, I just need a little tune-up with it," and I'll go, "Great."
Yeah,
but then
refresher.
usually that will stick. Yeah, and guess what? That's the way therapy works. Hey, I lost my job and now I'm dealing with imposter syndrome. Can we have a few sessions? Yeah. I mean,
Right,
our issues
exactly.
are our issues. We can't, it's not that it's going to be 100% gone forever, but some things are 100% gone forever.
It's amazing. I am fascinated. Well, Brooke, I want to thank you so much for coming on and giving like such a detailed, like an intense,
Yeah. I am
educational.
intense about it.
No, I love it. I mean, if you're not intense and passionate about it, why would I want to go to you, right? Why would I want? You have a great business model, honestly, because you're nurturing and you want to get people better. But where can people find you? Website, social media. What's the best way to reach out?
Sure. Well, you can definitely find us at brookebraylove.com. And again, we have two other amazing ART practitioners who I'm so excited that we can offer more, because I can't see everyone myself. My time is limited. And then you can follow me on Instagram and Facebook at Brooke Braylove Psychotherapy. And read about it, learn about it, and you don't, again, have to believe it will work for it to work. So when people come in and they're super skeptical, I'm like, great, I don't know why you would believe this work. We haven't tried it yet. And then when it does, they are literally blown away. Blown away.
Well, I hope everyone. I know I follow Brooke on Instagram, and she's always putting up good content. So, if nothing else, I think people should find you on social media and start to follow you. Definitely go to your website. It's definitely something that I'm like, okay, this is something that needs to be tried. This is pretty fascinating. But I want to again thank you so much for taking the time out of your day and explaining this to us. And I hope that everyone finds you. And I'm probably going to ask you to come back on again for another topic, because I just love talking about you. And this is the thing. You were very passionate about sexual wellness, and now you're passionate about this as well. And so Brooke has a lot of services that she offers. So hopefully we will be able to get back on here again for a new topic. But thank you so much, Brooke.
Thank you. It was great to be with you again.
Good night. Stops down.